I went to Sierra Leone and I was deployed to the city of Makeni, which is the fourth largest city in Sierra Leone, to one of the Public Health England labs. The Ebola treatment centre was called Matene ETC, and what I did over there was provide diagnostics for both the patients in the ETC and also samples that came in from the community. So all deaths in Sierra Leone had to be notifiable and the swab had to be taken, and we had to test that for Ebola so any contact tracing could be done.
I was in a place called Makeni, which is 3 hours east of Freetown, which is the capital, so right in the middle of nowhere. It was a Ebola treatment centre which is run by the International Medical Corps on behalf of the UK government. We ran the PHE laboratory. There were 16 of us. I was one of the joint team leaders. We had a team of 16 in total, and we were the ones who diagnosed the Ebola and malaria in the patients that came through the door and also in the community.
Well, it was quite a long journey to get out there, and I remember we taxied into the Lungi airport near Freetown, and I looked out the window and I thought, crikey, I'm in Africa. You know, I mean, it's the furthest I've ever been from home, and then the enormity of it kind of sort of hit me, and I thought, I'm walking into an Ebola outbreak, you know, the biggest one that there's ever been in recorded history.
It was quite a convoluted journey. We had two planes. We flew with Air Maroc, Royal Air Maroc, and we had a stopover in Casablanca when we got on the smaller plane that took us to Sierra Leone. We arrived at 5 o'clock in the morning. It was very hot, and there was lots of masked men with guns, and there was a lot of queues inspecting our visas and paperwork.
It was kind of overwhelming at first, but you quickly get over that and you quickly sort of get acclimatized, and you know you're out there, you've got a job to do, and every step has been taken to minimise any risk you're exposed to.
All the aid staff, the volunteers, the locals, everyone's really friendly. It was, considering what was happening around them, it was surprising how everyone had a smile on their face despite being massively stressed or under pressure.
Take every opportunity that you get. If I hadn't have said to my training officer, you know, do you think I could volunteer to go to West Africa? There's every chance I wouldn't have gone, and I wouldn't have had this incredible experience, and I wouldn't have learned the things I've learned, and it wouldn't have contributed to my training. So if you have a chance, or there's something you're curious about doing, just ask. You know, the worst thing that can happen is someone says no.